Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you'll learn it all.
And people are
Good question. Good afternoon, everyone, and welcome to A Gathering Place. And I am Marilyn Hemingway, your host for the day. And of course, A Gathering Place is sponsored by the Gullah Geechee Chamber of Commerce. Thank you for joining us on fourth Wednesdays when we talk about public health awareness and community health centers. And we have in the Gullah Geechee corridor a number of community health centers, but we're focused on every fourth Wednesday on the information brought to us by St. James Health and Wellness, found in Georgetown County, South Carolina, and northeastern Charleston, South Carolina, in McClellanville, Andrews, Georgetown, Choppy, North Santee, and Sanford. And the same information you hear from our experts today, you can hear from every community health centers, because for the last 55 years, they've been providing health care at affordable price. And it doesn't matter how much you make or how much you don't make, they are charged to provide health care to United States citizens and beyond. So we welcome our experts from St. James Health and Wellness today. Where today we're going to be meeting Natasha Colvin, our clinical pharmacist. Natasha, good to have you with us today.
All right. Thank you for having me.
Oh, you're welcome. Thank you for coming. And I'm looking forward to this information. And people are going to really find out about pharmacy deserts and how important being a pharmacist is to our community. And along with Natasha, we have joining us Miss Lynah, liaison and community outreach expert from St. James Health and Wellness. And as usual, Linda's bringing the good word to us every fourth Wednesday. So today, first, Natasha, before we get started, because you're new, but we're going to bring you back moving forward with all the good information. Tell us a little bit about yourself and what is a clinical pharmacist?
All right. So my name is Natasha Colvin. I guess at St. James, they refer to me as Dr. Colvin, but I'm a clinical pharmacist. So that's, I guess, usually when most people think of a pharmacist, they think of like in a CVS, Walgreens, independent pharmacy, behind the counter, filling prescriptions, counting pills, putting them into bottles and things like that. But my role is a little different. I've been at St. James for almost 2 years. It'll be 2 years on April 1st. And there I engage in annual wellness visits, which are once a year free visits offered by Medicare, where I make sure that patients are up to date on all of their health screenings, including mammograms, colonoscopies, pap smears, prostate screenings, A1Cs for patients with diabetics, going over the patient's medications, immunizations, checking their blood pressure in line. And it serves kind of like an in-between visits whenever the patient goes to see their doctor for their routine follow-ups or checkups. And then now I've seen that after I have these annual wellness visits with these patients, they have my number. So I think I'm on speed dial now. So they'll call me with any questions that they have, whether it's related to something that I probably can or cannot answer. So it's been a joy. So aside from the annual wellness visits, I also assist with chronic care management and transitional care management. So anytime that a patient is discharged from the hospital, usually their medications are probably slightly changed while they're in the hospital because of formulary. So after they're released, sometimes it can be a little mix up. So I like to call the patient and verify any medication changes that occurred during the hospital. So that way, whenever they come in for a hospital follow-up, we can align those medication lists together. And then thirdly, I guess a bigger part is our 340B program. So like you were mentioning beforehand, we do have a federal program, that provides us with assistance where we can allow our patients to have or access to reduced cost medications. So some medications like insulins for diabetics that could be astronomical in pricing, we're able to get those at reduced pricing, which share those benefits with our patients, so that way they have access to care and not have to end up in the hospital or God knows something worse like death just because they could not afford their medications. And then also newly, with this new pandemic that has been going on for the past year, I'm also assisting with COVID vaccine inventory at our site. So have the duty of keeping all of our vaccine numbers in control and reporting to the prospective portals. I think I tried
Very
to cover
good.
everything in a nutshell.
I apologize for disappearing off the screen for a second there. I had to grab my notebook because you were giving us such good information. I was writing my notes. So come back. So just to make sure I understand, you mentioned transitional care and chronic care. So transitional care is kind of like when you come out the hospital and you're transitioning back home and you're making sure that the patient understands the prescriptions, gets the correct prescriptions, and that they're taking the prescriptions the way they're supposed to. Is that correct
Right.
to kind of say that in layman's terms?
It is because usually the patient's insurance and hospitals, they obviously we don't want to see any readmissions. So a patient is kind of, I won't say obligated, but it's requested that they have we call it a hospital follow-up appointment within 7 days after they are discharged from the hospital. So in between that time, I try to go ahead and contact the patient to make sure we have those medication changes aligned. So that's
very good.
Transitional care management.
So then what is chronic care then? You mentioned that also. And I may have missed your explanation, but can you give us a quick explanation of chronic care?
Yeah, so chronic care management is related to chronic medical conditions. So usually we think of like diabetes, hypertension or high blood pressure, high cholesterol, COPD, asthma, things of that nature. So this is kind of like more in-depth care where me, I would basically reach out to the patient. And if there's anything that I can do to kind of help manage that, because those chronic conditions require a little more effort and work from both the patient and the providers. Although I'm not their provider, I can serve as like an adjunct to their provider. That way, see if there's any medication issues, because sometimes patients are on medications and they may be experiencing side effects or something like that, but not actually know that it's a side effect of their medication. So seeing there, and then sometimes patients do have side effects and just stop taking their medications completely because they don't like the way it makes them feel. So in those instances, obviously it would make the condition worse. So it's just more so of like a reach out to the patient on those chronic conditions to see if everything's going okay, and see if there's anything that we can do to help them manage their condition more, because we do want the patient to be proactive in their own health. So if it's like diabetes, making sure they have their testing supplies to test their blood sugars at home, because if they're not, we kind of don't have a way of knowing, like, are your blood sugars okay, or are they too high? Like, are you experiencing some symptoms and we don't know about it, or you end up in the hospital and we didn't know what was going on. And then of course finding like appropriate equipment, because a few weeks ago I had a patient requesting a specific blood glucose meter that actually talks to you rather than her having to just look down and try to read numbers, because sometimes it can be small. And if there's like eyesight or vision issues, then that makes a big difference whenever you can just wait on the machine to tell you what your reading was. And then blood pressure monitoring, same thing.
I'm glad you mentioned that. I have an aunt who diabetic, eyesight is weakening, not as it used to be. She's elderly, and I did not know that you had those voice things. So I'm going to mention that to her. See, already you helping out today.
Yeah.
I'm going to mention that to her, that she might need to get that the voice.
Exactly.
Yeah, because
Right.
I helped her set it up. It was a new thing for her with the diabetes, the testing. And I'm going to mention that to her because we might need to do that voice thing. So thank you very much. And thank you for explaining chronic and transitional care because it's good to know the difference and what to expect. We have Miss Lynah here with us, and you mentioned that you, Natasha, do COVID-19, the vaccine inventory. So it's a good time to hear from Lynah, who is the outreach community liaison, about what's going on with COVID-19 in St. James. I think you guys have some dates coming up
That's
that we can
correct.
go get our vaccination. And I just want to let you know, Lynah, I got my first shot.
Very good. I'm proud of
Thank
you.
you. Thank you.
You're
Yeah. I
welcome.
said I was going to do it, so I had to get it done. So got my
Okay.
first shot. Yeah.
Okay. Very good.
So April 8th is my last shot. So very
Okay.
good. So Lynah, what's going on with St. James with the COVID vaccines? What are the next dates? So those who have not had their shot, we can get them in and get their
Okay.
shot.
As you mentioned, we have 2 days at each of our sites that are dedicated to the community. And in the main site, which is in Charleston County at 1189 Tidwin Road in McClellanville, we provide shots on Thursdays and Saturdays. Now, you do have to call and see if there is available slot because the slots are really filling up fast. And in order to reach out to the person that's doing the appointments, you would need to call area code 843 990 7970. And once you call that number, a young lady will answer and she will, check to see when the appointment is available and she will be able to give it to you at that time.
So let me make sure I heard you correctly. Thursdays and Saturdays at the 1189 Tidwin Road, McClellanville.
Yes.
Call 843-990-7970. Am I correct?
That's correct.
All right. And that's to get it at the main site.
Yes. And the time is from 9 to 2. And at the Andrews site, which is located at 675 North Morgan Avenue in Andrews, that is Wednesdays and Saturdays. And in order to schedule an appointment, you would need to call area code 843-904-9304.
All right. So let me tell me the Andrews again.
Sure. It's area code 843-904-9304.
And what days is that?
That's on Wednesdays and Saturdays. And again, the person would need to schedule an appointment. And again, at the Andrews site, they're booking really fast. The other thing I wanted to make people aware of is that we are partnering with Neighbor to Neighbor. And basically what they will be doing is if an individual, especially a elderly person, needs a ride to the vaccine site in Andrews, then, or I should say Georgetown County residents, then they would be able to provide that ride. However, they would need to call at least 3 to 4 days in advance.
And is this 9 a.m. to 2 p.m. on Saturday, Wednesdays and Saturdays also?
Yes, that's correct.
All right, very good. And rides can be provided, but they need to call.
Yes, that's correct.
All right. I'm gonna get that one up there too. That's some good information right there, folks. So if y'all need to get that vaccine straight, do it now. And I'm scrolling the one in McClellanville right now. We'll keep that up a few minutes, and then I'll add the Andrews also and keep that up a few minutes. So y'all get your vaccines now. And we have the young lady here who's keeping track of the COVID vaccine inventory. And she also has a presentation for us. So Natasha, are you ready for the presentation?
I'm ready when you're ready.
All right, very good. Let me go ahead and get that up. Beautiful. She got a nice little PowerPoint for us.
Hey, we got awesome people that work with us.
You sure do. You sure do.
Yes.
All right. So let me get this started, and I'm ready when you are, Natasha. You go ahead and get started.
All right. So this is basically just going to be a brief presentation about the COVID vaccines that are currently available. And first, it gives us
When you're ready. All right. Very good.
overview over the coronavirus, I guess. You can go on to the next slide. You can go to the next slide. It's fine. All right. So here's what's known about COVID. So we know that the SARS CoV-2 is the virus that causes COVID-19. And as we have seen over the past year, it can result in a wide range of different symptoms. And it varies depending on age and comorbidities, which are the medical conditions. So we've seen kind of over the past year that those over 65 and those with chronic conditions, like I've mentioned before, diabetes, high blood pressure, and then respiratory conditions like asthma and COPD have tended to seem to have more severe illness and sometimes death associated with the COVID virus. So that's why it's very important that we keep ourselves, our families, and each other safe during this pandemic. The sooner we get this under control, the sooner we can get out of all of this quarantine stuff and back to our, I guess, normal, regular lives.
That's right. That's right.
Next slide. All right, so we know, I'm pretty sure we're all experts at trying how to prevent the COVID virus now. So again, like Ms. Hemingway, wearing your mask, and making sure that it covers both your mouth and your nose, because I've seen multiple times where patients just have it like right here. I was like, okay, you're kind of defeating the purpose of wearing the mask.
This is wrong. Don't do this. Do this.
Right.
Yeah. Mm-hmm.
So, and of course, social distancing. So staying at least 6 feet apart from others whenever you're in crowded places. Trying to avoid crowded places if possible, but I do understand, now that stuff is opening back up, everybody's out. So just making sure you maintain that physical distance, washing your hands often or using hand sanitizer with at least 60% content of alcohol, avoiding touching your eyes, nose, and mouth. I know sometimes for many people it's a habit where they're like scratching their face or something like that. Cleaning and wiping down or disinfecting hard surfaces as much as possible. And then, of course, lastly, I want to encourage everyone to get the COVID vaccine.
That's right. That's right. And remember, St. James Health and Wellness, they have 2 sites for the general public to come in and get those vaccines. And we have the McClellanville site scrolling right now, and we'll put Andrew's up in a few minutes. But go ahead, continue, Natasha. Very good information.
Yes. So again, getting the vaccine is very important just because we don't know how long the immunity lasts if and when you, God forbid, I wouldn't want anyone to get the virus, but if you do get the virus, we don't know how long that immunity from the virus will last. But I will say on the other side, we kind of are still in the works of knowing how long the immunity from the vaccine would last as well. But I would much rather someone get the vaccine versus suffer from a severe illness associated with the virus. So it's risk versus benefits. So of course, we just want to, again, protect everyone and just encourage the vaccine.
Very true. Very true. All right.
All right. So now we're going to move into the vaccines that are currently available, how they work, and then any type of safety monitoring.
All right.
All right, so I do want to, put this out there because I know a lot of people are questioning these vaccines because they're like, these things are happening so quick. Like, I know something's not right with everything coming out so fast whenever everything else has, I guess, like taken years to create. But we do want to ensure you know that these vaccines are being held to the same safety standards as all other vaccines. And the reasoning behind some of the expedited processes with these are, this isn't like new technology. And the work that has been done in previous years was kind of used as like fast track for these vaccines now. So we use previous information to start finalizing these COVID vaccines. So the FDA and the CDC are doing their monitoring. They did it before, during, and after trials, and we're still in the after trial surveillance. So we just want to ensure you know that safety is always the top priority.
Very good. That's good to know.
Mm-hmm. So again, like I was saying, there are 4 different phases of clinical trials that these vaccines have to go through. So again, phase 1, usually done in healthy volunteers. Phase 2 is like volunteers as well that could potentially be exposed to something. So that way we can test. So phase 1 is basically testing for safety. Phase 2 is for efficacy. So making sure that the vaccine works as part of what it's supposed to work for. And phase 3 is on a larger scale with more volunteers. And then phase 4 is what we call post-marketing surveillance, which is kind of currently what we're in now. So we're continuing anytime a patient gets a vaccine right now, we do want to encourage them to report any type of side effects or adverse reactions that they happen to experience. So that way we're continuing to have data to provide to, I guess, everyone about some of the side effects that a patient could experience. So it's important that big or small, still we just want to pay attention to it because we have some of the common side effects that has been shown, which I'll discuss in a few more slides. But like, again, we want to know everything we can. So that's why I just encourage to report. Next slide.
Very good. There you go.
All right, so right now we have 3 vaccines that have received the FDA Emergency Use Authorization, which is, you probably see as EUAs. So we have the Pfizer, which is 2 doses administered at least 21 days apart. The Moderna, which is 2 doses given at least 28 days apart. And then the Janssen or Johnson & Johnson, which is that 1 dose new vaccine that came out probably couple weeks ago, I can't remember, but it's the adenovirus vector vaccine. So in regards to the 2 doses, so the first one works as like a starts to build a protection or immunity, and then the second one serves as like a booster to strengthen your immune system to continue to build those antibodies. So in the event that you were to come in contact with the virus, your body's already built up, I guess, its immune system to be able to fight that off. Like I've mentioned before, the duration is not yet known. However, like I said, hopefully, over the next year, we'll be able to know if this is going to be like a flu vaccine where it's something you have to get once a year, or if it's, once every 5 years, once every 2 years, or something like that. But it's not yet known. But like, again, it's important to know that these vaccines have been tested in a wide variety of patient populations, age, genders, and different communities of color. So we do want to make sure that everyone knows that these have been tested, and they would not have gotten this far if they had not been.
Very good. Good to know that. I got a couple of questions, so keep going. I got to write them down.
All right. So the the Pfizer and the Moderna vaccines are what's called mRNA vaccines, or messenger RNA vaccines. So these vaccines carry genetic material that teaches our cells how to make a harmless piece of what's called spike protein, which is found on the surface of the COVID virus. So once our bodies come in contact with this, like I said, it starts to build the immune response. And if you've already received your vaccine, you probably know, but once you receive the vaccine, part of the immune response is those side effects that you experience. So you may have a fever, headache, fatigue. All of those are normal parts of your body building that immune response. So I don't want you to think of that as a bad thing. That's actually a good thing. That means your body's doing what it's supposed to do. Again,
so
I
the
want to
side effects. Go ahead. I'm sorry.
Oh no, you're fine. Go ahead.
So I hear that often people are like, the vaccine gave me the virus, but it's not giving you the virus. It's building up your immunity, and there may be some side effects. So that doesn't mean you have the virus. It's
Right.
just side effects. Okay. All right.
Exactly.
Very good.
And that's why
Very
I
good.
highlighted on the slide too that they cannot give you the COVID virus. So, and they will not in any way alter or affect your DNA. So we just want to put that out there too, because I know it's happened or has been said times and times again that when someone gets the flu shot, they say they got the flu from the flu shot, but it's your body building that immune response, and your body's doing what it's supposed to do.
One of the silver. Go ahead.
No, go ahead. I don't want to cut off your train of thought.
I think one of the silver linings in this unfortunate pandemic is I think people are really becoming more educated about how vaccines work.
Mm-hmm.
I think with the flu, we take it for granted. And I do, just like you said, I hear a lot of people say, I'm not going to take the flu shot because the last time I took one, I got the flu. When you didn't get the flu, you had side effects to the shot, but it's building, once again, it's building up your immunity and it's protecting you. So very good.
Right.
Please continue, Natasha. That occurred to me because you do hear that. Mm-hmm.
Exactly. I hear it a lot. I hear it probably like at least once a day. So I do understand. The trials for these two vaccines, the Pfizer and Moderna, did show a 94 to 95% effectiveness at preventing symptomatic COVID-19 infections after the second dose. So it is very important that once you start the vaccine series for the 2 doses, so the Pfizer or Moderna, that you do get that second dose as well to get that 90% effectiveness. I do want to point out, I'm not exactly sure what the exact percentages are, but these were the trial percentages. And you know that we've had variants come out now. So with the variants, these numbers have decreased slightly, but I know that they're still above 90% effective. So I don't want that to like sway anyone from getting the vaccine if they think, oh, well, we have all these variants out now, it's not even going to protect me. I know Pfizer and Moderna are still looking into, I guess, creating, I think they want to call them booster doses that will cover those variants, but I'm not exactly sure. I don't have a timeline on when those may be available.
The variants are another reason why we should even be more diligent in getting the vaccine, because we've got to stay ahead of the variant. And
Right.
if we want to achieve herd immunity and protection for society, the more people who are vaccinated, the safer you are from COVID-19, and the safer we will be from the variant. So y'all don't let that prevent you from getting your vaccines. You should be even more diligent about getting those vaccines. More diligent. Yeah,
And I
very
don't,
good.
again, that's not like something new either, because that's the same way that the flu vaccines work each year. Because usually whoever makes the flu shots, they base it off last year's, I guess, most popular variants that were out, and they try to predict what the next year's variants would be. So I don't want you to think that, oh, this coronavirus is like out here willy-nilly doing all kind of stuff, but it's exactly what the flu virus does each year. So it's all about predictability. So we're just trying to, you know, like Ms. Hemingway said, stay ahead of the curve, and try to, you know, combat this the best way we can. And like I said, this is not new technology. It's been around for other vaccines that we've, I guess, dealt with in the past.
Very good. Very good. And you want me to go to the next slide?
Yes, ma'am.
All right.
All right. And then, so the Johnson & Johnson vaccine, it uses a slightly different approach, but it's kind of similar. Again, it's giving your body the spike protein, but this time it's a harmless, it's called adenovirus, which is usually associated with the common cold. So again, it helps your body, triggers that immune response. So in the event that you were to come in contact with the COVID virus, your body is able to fight it off. With this being a 1-dose vaccine, obviously the effectiveness is slightly lower, but these percentages aren't like apples to apples. It's apples to oranges, because the Pfizer and Moderna they were looking for a symptomatic COVID infection. I think it's at 7 and 14 days after the second dose. With this one being the one dose, they were looking at the effectiveness of preventing moderate to severe COVID infections 28 days after the injection. And what they consider, I guess, the definition for their moderate to severe disease is a combination of a positive COVID test and at least one symptom, like it says, such as shortness of breath, beginning 14 or 28 days after the single shot. However, I do want to point out that it was 85% protective against severe disease. And I think the trial said no hospitalizations or deaths were noted in the trials for the Johnson & Johnson vaccine as well. So like I said, I don't want to sit there and compare that 94, 95 to a 72 because they were looking at different outcomes. So I don't want people to, get so caught up on the numbers. Like, of course, they're all three have been, approved with the EUA. So they're all, effective at preventing the COVID virus.
Very good. Good to hear that.
All right. So I know we've touched on this a little bit. So about the side effects, some of the most common ones include pain and swelling on the arm in which it was given. I will say that was the worst for me. When I first got it, I was like, okay, it felt, sore. But that next day, I was like, oh, my arm is really, really sore. But you have to really work that pain out. Fever has been associated, chills, tiredness, fatigue, headaches, and muscle aches. I will say that most people say that most of these side effects come after that second dose because, again, like I said, that's after your body has started that immune response. And then once it gets that second shot, which is like the booster, it's like, oh, this is this again. So it's like, okay, we're ready to fight now. So that's why your body ends up with all of, like, I won't say all of those, but you may experience some of those side effects a little more than you did after the first vaccine. However, it was noted that at least 8 weeks of safety data were gathered, and side effects usually don't occur 8 weeks after vaccination. But I know most people, the side effects are gone within a day or two. So I don't foresee, but everyone's different. So I don't want to just make a blanket statement. But, usually within a few days, those side effects have subsided.
Very good. I experienced that evening. They told me, keep moving your arm. And of course, you go about your day and you really don't think about moving your arm to kind of, as you say, work that pain. And that night before I went to bed, it wasn't really, I could tell
Right.
that,
Right.
yeah, I had some pain, but I just kind of moved my arm, stretched it, and it eventually just went away.
So, and again, if it, like this slide says, if it does become too bothersome, you can take some over-the-counter remedies. So some ibuprofen or Tylenol, applying a cool, clean, wet washcloth if you have any fever, or just to cool yourself down. Stay hydrated, water, drink plenty of fluids, dress lightly so that way your body can cool off. However, with me being the pharmacist, I do want to say, I know some people kind of proactively take Tylenol or ibuprofen before they go get the shot to kind of, decrease. I personally don't recommend doing that because I feel like it kind of hinders your body's natural immune response to have, like I said, those side effects that you would have. So I say use it as a last resort. Like if you're checking your temperature and you have like a fever of 104, obviously we need to reduce that fever. But if you're like at, 99, that's something your body is doing naturally. And if you can handle it, I would say you can hold off on the ibuprofen or Tylenol. If the headache or something is like I said, way too bothersome, of course, go ahead and do that.
All right. Next slide.
Yes, ma'am.
All right.
Again, like I said, most of these side effects will go away within a few days. However, if something does become too bothersome, we do want you to contact your healthcare provider, especially if there's like worsening of symptoms. And then also on the next slide, but I'll get to it, what's called anaphylaxis. So if you do have anaphylaxis, which is like hives, shortness of breath, or anything like that, that's a medical emergency, and we do want you to, call 911 and seek emergency help as soon as possible. Again, it's important that you get both of the vaccines of the 2-dose series. Even if, like I said, even if you have some side effects, that's not a, contraindication that you shouldn't get the second one. That's part of the body's natural immune response. And again, it's important to note that you aren't fully protected until at least a week or 2 after your second shot. So I don't want you to, get your first shot and it's like, oh, okay, I can go out, not wear my mask or anything like that. You still need to maintain all those precautions until at least a week or 2 after your second shot.
And you should continue to maintain precautions, as I've heard, to protect other people, because you may carry and expose other people. So we need to be diligent with our mask wearing and continuing those safety procedures. And y'all, I'm sorry, I'm probably sounding a little preachy today, but I'm trying not to, folks. I just care about folks with this.
I do too.
We don't want people to get sick. But go ahead, Natasha, continue. Yeah. Mm-hmm.
All right, and I do want to just make you aware too. So whenever you do go get the COVID vaccine, just be prepared to wait after you receive the vaccine. 30 minutes if you've ever had an allergic reaction to a vaccine in the past, but 15 minutes for all other persons. I did have a friend, I guess she wasn't aware before going in that she would have to wait because she was, I guess, had other things to do. So when they told her she had to wait 15 minutes, she thought something was wrong. So it's like, just, as a precaution, just know and expect to wait those 15 minutes just to make sure there's no side effects or anything like that are happening.
Very good. All right.
And again, this is just going over the anaphylaxis that I referenced. So if you experience any of these symptoms, please do, if you're at the clinic or wherever you just got the vaccine, make sure you wave somebody down, get some help. So that way we can assist you. Anaphylaxis is usually treated with an EpiPen, which is an injection into your thigh to, stop that until we can get you to the emergency room for medical attention. So like I said, shortness of breath, wheezing, coughing, hives, itching, swelling of the lips or face, all of those are signs of anaphylaxis. So be on the lookout. Not like it says, it's rare, but I do want to make it noted that if you do experience any of these symptoms, we need to get, help for you.
Very good.
All right. Now, as far as safety monitoring, so there are a few systems in place. I'll just go over this main one on this page that's existing, which is called VAERS. It's a website in which anyone can go on and report any of these side effects. Usually they're looking for ones that are outside of the normal, like the, like I said, the fever, headache, chills, fatigue. So if you have anything outside of those, we do want you to report those to VAERS. Like I said, you can go on Google and type in VAERS and it'll bring up the website. And it just has some questions that you would fill out about the vaccine and what happened, where you got it and stuff like that. And it sends it off to the FDA. And then on the next slide is the new system that they put in place with the COVID vaccine. It's called vSafe. It's a smartphone app. So usually during your 15-minute wait, that's something that you can sign up for. It basically just asks you questions about your post-vaccination, experience, any side effects that you may be experiencing. It has simple questions and, easy to read or easy to put your answers into about how you're feeling. And if it's something that they note as severe, you could get a call from the CDC to help you out with, managing those side effects. And they do manage you days after you've received, like the day of and days after you've received that vaccine. And it also gives you a reminder for your second dose as well.
Oh, this is good to know. That I didn't know about this. I wasn't told, but I didn't go to St. James Health and Wellness. That's why. All right. So see, if I had gone to St. James Health and Wellness.
It should be at all sites, though. They should have gave you some information on how to sign up for the vSafe app. It should be everywhere.
Oh, okay. I believe you. I believe I totally missed it then. All right,
Okay.
so I'm gonna look it up because that sounds like
All
it's
right.
very important. All right,
Yes.
very good. And next,
Mm-hmm.
all
All
right,
right.
this
So
is when to get your
again,
vaccine. All right,
right. This is the, I guess the plan, the South Carolina COVID vaccine phase plan. So we're currently in phase 1B right now. I know we're kind of getting our way on through, but this just shows, hopefully, I know spring has already started, but phase 1C, it says late spring. I think President Biden said by May, the end of May, he's hoping to have enough COVID vaccines available for everyone in the country. So maybe sooner than summer, fall, everyone who would like to get a vaccine will have accessibility to receive it. But like I said, right now we're in phase 1B, which is those like with some of those chronic conditions and those 55 and older. So, and then of course our essential workers and healthcare workers.
it's good to see this happening, especially now that we've decided as a national government to get serious with addressing COVID-19, and you can tell the difference. So that's my political moment of the show. So we'll keep going, Natasha. All right.
And then on the next slide, I had just some information of where you can get the vaccine. So, of course, your local health department, so DHEC, has different, I guess, like little portals online where you can go in and set up your appointments. But, of course, we're all Google friendly. So, of course, if you just type in COVID vaccine near me on Google, it will probably list a whole bunch of different sites that you can get the vaccine. But of course, I work for St. James, so if you're in the Georgetown area, like I said, our information is scrolling across the bottom. So main site and our Andrews site, please feel free to come in or call to make your appointment so that you can come see us to get your vaccines. But like I said,
Very
there are
good.
sites all over the state for you to get it.
Yep. And we, of course, are sharing the St. James Health and Wellness information at the bottom of the screen. Right now, we're scrolling the McClellanville site information. And as soon as we finish this slide, we will share the Andrews information. Finish
Okay.
all of the slides. All right. So now common questions about COVID-19 vaccinations. I'm sure you get quite a number of questions, Natasha. And
Right. These are
she's
just
here to share it
some.
with us. There you go.
These are some, not all. But I did want to point out, because I know it may be a question. So we at St. James, we have the Moderna vaccine, in case anyone wanted to know which vaccines we have. So the first question is, can COVID-19 mRNA vaccines cause you to test positive on the COVID-19 viral test? So in short, I guess the viral test, which tests to see if you are currently positive for the virus, they will not be positive if you get the vaccine. However, those tests can pick up any, if there's a possibility that you were exposed in the past, it could show a previous infection. So that's how we kind of want to differentiate there. So it won't show, the vaccine won't make you test positive on the viral test. However, if you do the antibody tests, which are showing if you've had some previous immunity to it, then of course your body has built up that immune response from the vaccine. So it will look similar to you having a previous COVID infection. So viral test, no. Antibody test, possibly.
Okay, very good. So I have a quick question, and
Mm-hmm.
we'll go forward because you might answer it. So we'll go
Okay.
to the next question.
All right. Can people who have gotten sick with COVID virus still benefit from the vaccine? Of course, yes. We want to encourage everyone to get the vaccine whenever you can. There has been there was some guidance out that said that after you have the virus, that you potentially have immunity for up to 90 days, which meant that you could delay your vaccine for 90 days after you had the virus. However, now there has been new guidance out where they're saying after you have finish your isolation or quarantine, so the 10 to 14 days up to that 90-day window is whenever you're encouraged to get your vaccine after you've been sick with the virus. So if you have the virus now, finish your quarantine period if it's 10 to 14 days, and then you have from then up to the 90-day window to receive the vaccine.
All right, very good.
All right. Should individuals who are pregnant or breastfeeding wait to get vaccinated until more data is available? The CDC is encouraging pregnant or breastfeeding women to receive the vaccine, just again as benefits outweigh the risks. However, this is something that must or should be discussed between the patient and their provider, again, to know the risk versus benefit. Again, it's probably preferred to wait until the patient or mother is out of their first trimester. So we know that the first trimester is always that the one where we want to stay safe. Usually, like with the Tdap, which is the tetanus shot, most pregnant women end up getting that after, I guess, in the third trimester. So this will probably be similar. Breastfeeding, again, something that you would potentially want to discuss with your provider. I will put my personal experience out there. I am currently breastfeeding, and I did get the COVID vaccine. So if anyone had any questions, I'm more than willing to ask. These trials did not show any evidence of infertility in women or sterility in men. So
very good. And congratulations on the baby.
Thank you. And then should individuals who are immunocompromised wait to get vaccinated until more data is available? There are no contraindications. So if immunocompromised, so those are patients who may be on some suppressed type agent. So cancer patients or those on like steroid treatment, which steroids are kind of help to build the immune system back up. But usually those are your sicker patients. There's no contraindication for these patients to not receive the vaccine. But again, like I said, I'm not that patient's provider. So this, again, is a conversation that should be had with their provider to be able to discuss any potential risk versus benefits. And there's no recommendation on revaccination after a patient's immune competence is regained.
All right, very good.
Can a patient, this is in reference to the 2-dose vaccine. So can a patient who received like the Pfizer receive the Moderna vaccine as their second dose if that's the only thing is available? The answer there is no. You should not mix those COVID vaccines. I don't care if it's the Pfizer, Moderna, or the Johnson & Johnson. None of them should be mixed because they were not studied that way, and we don't know how they would react. Each dose, like I said, of the 2-dose series should be from the same manufacturer. And of course, in the Johnson & Johnson case, you don't have to worry about that because it's 1 dose. And that's been, the hype around that one is because it's 1 dose. So that's beneficial for those with transportation issues or any type of availability issues. It's 1 and done. So
that's right. And even if you're scared of getting shots, 1 and done.
Right. Should I restart the vaccine series if the 21 or 28-day vaccine spacing is missed or inconvenient? So you should never restart a regimen. So if you get the Pfizer, which is the 21-day, or the Moderna 28-day, if you miss that window, don't fret or anything like that. There is a grace period. Actually, the second shot may be given up to 6 weeks, which is 42 days after the first dose. Now, beyond 42 days, we don't have any information, but the CDC has given guidance that you can give the second dose up to 42 days. So if that's not enough time, I'm not exactly sure what to tell you.
Yeah. Well, folks, we'll work with you, but we need you to work with us also, and don't deliberately miss that second dose. Go ahead and get in if you can, and if you have transportation issues, St. James Health and Wellness is working with. What's the group, Linda?
It's called Neighbor to Neighbor.
And they're providing rides to and from your vaccination appointment. So
Right,
we're trying
throughout.
to help folks in many different ways to get their vaccinations done.
Right, and that's throughout the town of Georgetown. And also, if they need to get the ride, they can reach out to Mr. Joe Kunkel, Kunkel, and his telephone number is 843-685-0745.
All right, and folks, we'll get that on the screen to you also in just a moment. And Natasha, next slide. You want me to go next slide?
Yes.
All right.
That was all the questions that I had. I know you may have had some questions. My last two slides are just about some resources, information. So again, you can always reach out to your local or state health departments, your primary care provider, and of course the CDC and websites are always updating their information on a probably more than once a day basis to find the most up-to-date information on these vaccines.
Very good, very good. And I'm going to, there we go, close that here and get back to you. And my question was, between the testing, say if you suspected that you may have had COVID, then you go get a test. How long would that test be effective? Like if I had COVID, I suspect in 2020, we're in March. I suspect that I had COVID in March 2020. If I take a test now, would it show up that I had, or is that too long?
Yeah, the tests that are currently out for COVID testing is for like active infections. The antibody test, however, will show evidence of a previous infection, but the just regular viral test won't show previous infection.
All right, and I have a question here, and I think you may have answered it as you were going through those questions, but I had the virus and was told to wait 90 days after my negative test. Is that true? And I believe you answered that. So is that true, to wait 90 days?
It can be up to 90 days. However, so there's like a caveat. So the CDC, like I said, has given guidance that if you have had the virus after your quarantine period is over, so if it's the 10 to 14 days, you have between that 10 to 14 days up to that 90-day window. However, if you receive treatment for your COVID infection, so if you receive like antibodies or plasma, then that's whenever you're required to wait that 90-day period, like after the 90 days. So I'm not exactly sure if that patient had received treatment. So if they did receive treatment, that's why they were told to wait 90 days after that negative test.
All right, very good. Got you. So I'm going to change the subject for a moment here, and then we'll bring Linda in, she's here, to talk about what's going on regarding the funeral arrangements for those who died from COVID. We do want to hear more about that. But the question I have for you, Natasha, is what are pharmacy deserts? Can you explain that to our viewing audience? And how are those pharmacy deserts being addressed by community health centers?
So pharmacy deserts, obviously with us being in the rural community, most, pharmacies like CVS, the big chain pharmacies anyway, CVS, Walgreens, those are not usually nested into our small communities. So those communities oftentimes don't have any accessibility for patients to be able to get their medications in a timely manner. They're probably late, or they don't have transportation to be able to go get it. So they just get out when they can. So again, that leaves either sometimes, if the community is lucky, we have what's called independent community pharmacies, where there are like small mom and pop pharmacies that are locally owned. Sometimes you will find those to kind of help with relief of those pharmacy deserts. Ours isn't, necessarily located in a desert, but we do St. James partners with Care Pharmacy, which is located in Georgetown, and that's our contract pharmacy, which is also an independent community pharmacy. So again, with, I guess, in those pharmacy deserts, the community health centers are, you know, I guess, trying to think of the word, assistance to our patients, because many of those health centers have what's called in-house pharmacies. So rather than having, I guess, a CVS or something down the street, you can have a pharmacy inside your community health center that works just the same way as any other pharmacy does, where you can fill the prescriptions, and that way the patient will be able to access their doctor and then just walk like 2 feet to the pharmacy and get their medication and have everything after they leave the doctor's office. However, St. James doesn't currently have an in-house pharmacy. Like I said, we just have our contract pharmacy. However, I have spoken with Ms. Gilliard, and we are considering having that discussion about implementing an in-house pharmacy. So that way, like I said, in some of our rural, I guess, spaces like our Sanford and Choppy areas, we do have that accessibility for patients to be able to get their medications.
Very good, very good. I certainly hope y'all will consider the pharmacy, because I think, especially in the rural areas, it's just so important that we provide that. And I don't think people really realize how bad it is in rural areas, the lack of access to pharmacies, because that impacts your health care. Yeah. So, and we kind of take it for granted. Even here in Georgetown, which is a small town, we have a pretty healthy number of pharmacies. And I don't think the average person really even thinks about the impact of that you can call your pharmacy or call your pharmacist and just go right down there, and get your prescriptions filled. And that's huge. That's huge. So it's good to hear that you guys have some things that you are with St. James Health and Wellness, and that the discussion is happening now about creating that pharmacy, especially in our rural areas. And also, I know the 340B, and just because you're a community health center, she got some really good prices on prescriptions. You could tap into resources to really lower those prescription prices. So good deal there. Very good. Natasha, thank you very much for that great PowerPoint presentation. Lots of pretty slides. And really good information. And it's really good to hear from you. So let's segue now to Lynah. Lynah,
Yes.
Can you tell, I am uploading that as you talk, but can you tell us about this new program? I understand that they're going to have some help with funeral costs. Am I correct with that?
Yes,
okay.
You are.
And what does that mean?
Basically, the COVID-19 pandemic has brought overwhelming grief to many families, and FEMA's mission is to help people before, during, and after disasters, and they are dedicated to helping ease some of the financial stress and burden caused by the virus. So therefore, under the Coronavirus Response and Relief Supplemental Appropriation Act of 2021 and the American Rescue Plan Act of 2021, FEMA will provide financial assistance for COVID-19 related funeral expenses incurred, after January 20th, 2020. And FEMA will begin to implement this COVID-19 funeral assistance in April. And basically, the guidelines are being finalized and will be released to potential applicants and community partners as soon as possible. In the meantime, people who have COVID-19 funeral expenses are encouraged to keep and gather documentation. They are working to set up a dedicated toll-free number that can be used to apply for funeral assistance. And more information will be available on this page as soon as possible. And the page that you can go to look up the information is listed at the bottom of the information Marilyn has posted. Now, one of the things they say, in order to be eligible for funeral assistance, you must meet these conditions. The first is the death must have occurred in the United States, including the U.S. territories, and the District of Columbia. The death certificate must indicate the death was attributed to COVID-19. The applicant must be a U.S. citizen, non-citizen national, or qualified alien who incurred funeral expenses after January 2020. There is no requirement for the deceased person to have been a U.S. citizen, non-citizen national, or qualified alien. In order to apply, as I mentioned before, you apply in April, and if you have funeral expenses, then they encourage you to keep and gather documentation. And the types of information you should include is an official death certificate that attributes the death directly or indirectly to COVID-19 and shows that the death occurred in the United States, including the U.S. territories and the District of Columbia. The second is funeral expenses documents, receipts, funeral home contract, etc. That includes the applicant's name, the deceased person's name, the amount of funeral expenses, and the dates the funeral expenses happen. And then also you do have to provide proof of funds received from other sources, specifically for use toward funeral costs. And they are not able to duplicate benefits received from burial or funeral insurance. Financial assistance received from voluntary agencies, government agencies, or other sources. And the last but not least is how are funds received. If you are eligible for funeral assistance, you will receive a check by mail or funds by direct deposit, depending on which option you choose when you apply for your assistance. So as I indicated, you would need to go online, and it can give you the information that I just went over to let you know what you need to do. And as indicated, it will be effective as of April 2021.
So the website for all of you, if you cannot read it, is FEMA.gov/disasters/coronavirus /economic and /funeral assistance. And the easiest way to do it, if you have access to a computer and to website, just Google FEMA.gov funeral assistance, and believe me, it will come up. Or go to FEMA.gov and their search. Usually it's a little magnifying glass. Just type funeral assistance and it will come up. It's the easiest way to do it. And I, for one, I lost my father this year, and it was not from COVID, but I certainly hope those who were impacted, unfortunately, by COVID, and you lost a family member or a friend, is to look into this and and really I appreciate that our government is stepping up and helping with this, because we've lost over 530,000 souls, and it's the least that we can do. Totally unexpected. And well, actually, the pandemic was not unexpected in the sense that we've been warned, but that's another conversation on how we treat our earth, and that's another conversation. But at least we're getting some help in very sad, tragic, unfortunate times. So, Natasha and Linda, I want to express my appreciation to you both today for coming on the fourth Wednesday and sharing some really good, detailed information with us and really helping us with this information. I like, Linda, I like this kind of information. This is meaty information.
Yes. And thank you for having this.
Get to work right
program.
now. Mm-hmm. Yeah. With the funeral costs, and Natasha, really, you giving us that information about the vaccines and answering those questions and just giving us a good in-depth detail about COVID itself. I don't know if you know Dr. Thaddeus John Bell, but he and I have been dealing with this for over a year now. He started with me when I started a gathering place. It was to be a podcast, and it will be a podcast. But also, I had to get it on Facebook and YouTube because I said, people are asking questions about COVID. Mm-hmm. So it is nice to see a clinical pharmacist come on and talk about this. So thank you very much for joining us today. Linda, anything else we need to know going on with St. James?
Basically, that's pretty much it. And if a person is interested in being a patient of ours, we welcome it wholeheartedly. And also, we do provide assistance with, as you all know, they have extended the health insurance marketplace until
Mhm.
now they're saying August.
Oh,
And
wonderful, wonderful.
yes, yes. And one of the things that we do is we do have outreach workers or community health workers that can assist the person that needs assistance with applying for the benefits, as well as we assist with applying for Medicaid, Medicare, food stamps, and also disability. So please feel free to give us a call because we are able to assist any individual, not just our patients. And one of the awesome thing is with our health center is that if you qualify for the Healthy Connection checkup, then you can come to us for $10 a visit, which also include your in-house labs. So if you have any further questions, feel free to give me a call. My number is 843-826-3773. And once again, that number is 843-826-3773. Thank you,
Very
and may
good.
God bless each of you.
Thank you, Linda. I appreciate that. Natasha, thank you also for joining us. We're going to have you back to give us some
Okay.
more good pharmaceutical news because there's always something that we need to know when it comes to our health care. And also, this is Pretty Baby. She wanted my attention, and Pretty Baby approves this show today. All right. She's usually like, I'm out of here, but she wanted to come say hi. So,
Oh,
everyone, thank you for joining us today. Natasha, Linda, thank you for joining us today.
thank
And I'm
you.
looking forward to the next fourth Wednesday in April when we talk
Yes,
more about public health care. Enjoy
yes.
the rest of your day. Thank you for joining me, Natasha and Linda, and we'll see you next time.
All
Thank you
right.
for
Bye
having
bye.
us, and may God
Thank
bless you.
you. And everyone, it was great news today about public health care. Thank you for staying with us and getting some really detailed information. And I just want to remind everyone that you can view a gathering place every Wednesday and Sunday here at every Wednesday and Sunday here at Facebook Live and YouTube Live. And we have coming up next Wednesday Sue Ham Entertainment, Sulandia Hammond of Sue Ham Entertainment. She's doing some really good shows with entrepreneurship and education. So we're looking forward to having her here to talk about her upcoming educational programs that are happening. So, this is all about working together, folks, and creating economic uplift for our communities. So join us this coming Sunday at 4. But I wanted to make sure that we started promoting Suham on next Wednesday. Enjoyed having everyone here. Enjoy the rest of your day, and we'll see you Sunday at 4 o'clock. Good night, everyone, and have a great day.